Thank you everyone for joining us today for our Arts and Health Bridging Creativity and Care, launching the introduction guide to arts and health. Thank you again for everyone that's taking a moment to join us. And also a big thank you, as you see on the bottom right hand of the screen, the Music Foundation has been an incredible support with our work with the Arts and Health Initiative. And so we want to acknowledge them and just say thank you to them for supporting this important work at an important time. And we will get into our webinar. Let's go ahead to that next slide. All right, so we're going to start with introductions. I'll start with introducing myself, and then I welcome you all to introduce yourself in the chat, share what organization you might be connected with or affiliated with, and then also share the land, the indigenous land that you reside on. My name is Nefeshi Israel. I am the Director of Programs here at California for the Arts. And let's see, I live in the Central Valley on Yokut's land. And today we just actually did a proclamation for Arts, Culture, and Creativity Month here in Fresno a little bit earlier today. And our poet laureate was also announced, and she did a poem that was beautiful about our town and about our indigenous land. So really just wanted to acknowledge her also, Adid Medina. Again, this this webinar is being recorded. You'll receive the slides, the recording, and all of the resources will be shared with each of you after this webinar. You can go ahead to that next slide there. We have a few guidelines. If you have any questions, we welcome questions the entire time. You will see at the bottom of your screen, it's a Q&A button that you can click. It literally says Q&A, and it has a little box with a question mark inside of it. We ask that you drop your questions in the Q&A function so that we can easily respond and they don't get lost in the chat. So if you have questions, please drop them in the Q&A button, and then the chat we can share for other things. While you're in the chat and communicating in the chat, please be sure please avoid buzzwords and explain any references and acronyms. For example, Arts, Culture, and Creativity Month internally with our team, we like to call it ACCM, and many of you probably already do, but that's an example where not everyone understands that. We also ask for respect. So please be respectful, honoring other perspectives in the chat. We don't usually have problems with that, but we always like to just, lay a foundation that we will continue to respect one another. And if you're not comfortable speaking up, you can follow up with us directly. And if we do not, I think there might be another slide with this one there, but I'll just say it now because it's on my mind. But if we do not get to your question in the Q&A feature, then we will make sure that we're answering those questions during the webinar and then after. So if we don't get to your question, we will be sure to answer it after the webinar. And we can go to the next slide there. All right, a few tips for Zoom specifically. These are our subtitle tips. And if you would like to have subtitles where you can see on your end, there is a show captions feature at the bottom of your screen. You can click show captions and hit the little up arrow that will allow you to adjust your captions. And so if you need that, that is there as a resource. And we can go to the next slide. Thank you. All right, a few more Zoom tips. If you would like to change the view and see the image of the speaker, maybe a little bit bigger or a little smaller so you can see our slide deck, then you can click on the view at the upper right-hand corner. You'll see it says view. It's a little rectangle, a vertical rectangle, and then 3 boxes next to it. You hit side, you can select side by side option, and then there's a few different options there with speaker gallery and multi-view. And if you would like to make it bigger or smaller, you can hover your cursor and press down on that little gray box that you'll see. It's circled in yellow. Thank you, Jen, for highlighting that there. And you can move that back and forth to make your screen, the slide deck, bigger or smaller. All right, next slide. A little bit about our Q&A feature. This is what I was saying. I think that this is mentioned later. So this is step-by-step how to use our Q&A. You're gonna click on that Q&A button at the bottom of your window, type your question in the pop-up window, and again, not in the chat box so that we don't miss your question. And then questions will be answered verbally or written in a written form. You'll see it, if it's written, you'll see it in that Q&A feature. And again, due to time limits, if we don't get to all of the questions, we encourage you to still share those questions because we will answer them. It just might be after this webinar. All right, go ahead to that next one. All right, so this is a little bit about our organizations. I'm going to do this very briefly. You can go on our website and learn a little bit more. We have CA Arts Advocates, which is at the top here in the center. That is our 501c4 organization that focuses on lobbying. And we do a lot when it comes to systems change, public policy development, and public investment. So that's our California Arts Advocates. And then we have California for the Arts, where we do our statewide programming. So we serve the communities across the state. We do advocacy networking and training. And we also have different programs throughout the state to help people learn how to advocate for themselves, how to do things like proclamations in their cities for Art, Culture, and Creativity Month, and a host of other things. And under the umbrella of California for the Arts is our Arts and Health Initiative. So that's kind of how we're structured. And we can go ahead to that next slide there. Thank you. This is a little bit about Arts, Culture, and Creativity Month. As I mentioned earlier, it's our annual celebration, and I don't say just ours, it's a statewide. So everyone that is invested in the arts, interested in the arts, interested in culture and creativity in their community, can celebrate Arts, Culture, and Creativity Month. This is the 7th year celebrating it. As you see here, in 2019, it was declared by the California Senate in a concurrent resolution. And then in 2021, we also were able to add a resolution that declared, to recognize artists as second responders. And a part of that, continuing that work from 2021 to now in 2025, we are celebrating Arts, Culture, and Creativity Month with the theme of health, healing, and hope. And you can learn more and receive more resources when you get this slide deck, and you'll be able to download this toolkit, the toolkit here, and learn more about health, healing, and hope, and also about how we can continue to socialize this important work through this toolkit. And we can go ahead to that next slide. Additionally, with Arts, Culture, and Creativity Month, we have the summit. So if you are not registered, we are doing an incredible work here, bringing the state together to make sure that we are all kind of in unison and know the work that and know the networking opportunities also, and the work that we all are doing across the state to enhance the arts and culture in our various communities. So it's a great way to come together, learn about other work, and also share what you're doing in your community. The tickets are currently on sale. They will be on sale at least for the next week or so, as we continue to sell tickets. And also, I'm not sure if it's in this slide deck. I can't remember offhand. I don't think so, but make sure if you know somebody, an artist or creative or a culture bearer in the city of Sacramento, that would like a scholarship. We have scholarships and we want to give them away. So you can contact us, and we'll also, before the end of this webinar, we'll put it in the chat of how you can register, how people can register for scholarships. So again, it's only for people that live in the city of Sacramento. Our statewide scholarships the deadline has finished, but the deadline for Sacramento-based scholarships is actually tomorrow. So please be sure, if you know someone, I'll share the link in the chat a little bit later, but make sure that you share with them that we have scholarships, and we want to make sure that artists and creatives are at the summit this year. We also have an artist ticket price at half off. So when you go to register, and if you're a student or an artist, then you can get half off for your ticket. All right, we can go to that next slide. We're going to talk a little bit about Arts Advocacy Day, which is on April 23rd, the day after the summit. We always like to do these paired to one with another, paired together, so that we can really make the most of our time in Sacramento. And again, thank you to the city of Sacramento for supporting this work. We will be at Capitol Park on April 23rd, organizing. We've continued to organize Arts Advocacy Day. Registration for Arts Advocacy Day is actually ended, but if you have registered and you have any questions for us, then please reach out and you can learn more about Arts Advocacy Day. All right, and you can go ahead to that next slide, and I'm going to introduce Jennifer Kuo, who has been an incredible addition to our team as a consultant, a special consultant working on our arts and health initiative. If you have not met Jennifer, then I'm excited that you have the opportunity to hear her speak today about her work in arts and health. Now I'm going to read her bio real quick, and then I'm going to pass the microphone over to Jen. Jennifer is with 20 plus years of experience. Jennifer brings an assorted spectrum of skills with her background working in health and wellness, community engagement, education, marketing, and event program planning for corporations, nonprofit organizations, and the public sector. For the past few years, she has focused on initiatives that explore the intersection of arts and health and well-being, mainly in the areas of education, research, and practice. In addition to developing our arts and health initiative, she is also a contributor to the research lab at the University of Florida Center for Arts and Medicine, supports education and programming for Social Prescribing USA, and is the LA chapter chair for Sisters in Public Health. Her professional journey includes past roles at Tom's, we all know Tom's, the shoe brand, the Walt Disney Company, and Boys and Girls Club. She authored our newly released introduction guide to arts and health, which you can download from our website, and if you haven't done so already. This guide is published by California for the Arts as part of the Arts and Health Initiative and sponsored by the Music Man Foundation. Won't you all help me in acknowledging and welcoming Jennifer to this webinar? And thank you, Jen, for taking the time to walk us through this guide.
Thank you so much, Nafesha. It's a pleasure to be here with you all. I think we had about, last time I checked, over 350 of you registered. And so got to see the ones that could make it live, and look forward to hearing folks watch it in the webinar afterwards too on the YouTube channel. So again, for the past few years, I've been listening, learning, offering, observing, inquiring about all things related to this intersection and compiling resources. So today's webinar is focused on the launch of the Introduction Guide to Arts and Health. It's a bird's eye view that includes resources ranging from existing programs to research. And we really hope this guide will pique your interest in learning more about all the layers and inspire you to get involved in arts-based initiatives to improve the health and well-being of your communities. So we hope this guide will jumpstart your own ideas, and you can share it with colleagues and perhaps students if you're in education. I also like to give a shout out to the whole entire See It for the Arts team, the Music Man Foundation, and special shout out to Jin Young on the See It for the Arts team, who created this lovely design for the guide. Additionally, we want to thank and recognize the invaluable contributions of the individuals and organizations in the field of arts and health, whose work is highlighted in this guide. And from the time between when we completed it and this webinar, there are already many new resources on this topic that came out. So it really speaks to the rapid increase of interest and curiosity. And so as one of our key initiatives, CA for the Arts recognizes the arts as a powerful tool to enhance the health and well-being of our communities. Therefore, we would like to acknowledge the many artists, culture bearers, creative workers who have been serving as health and wellness practitioners for generations. We understand that while the conversations around arts and health may seem new, these practices have been deeply rooted in diverse communities worldwide. Let's show some love for all those involved, for generations and future and present. So art is believed to have begun in the prehistoric period of human history as far back as 15,000 BCE. Cave paintings such as this one found in Brazil shows jaguars, deer, and human figure dancing and hunting. So the arts was not just a nice to have, it was a way of life. And then as time went on, it somehow slowly became separated from what once was practiced as a human basic need. So I'm guessing that all of you tuning into this webinar enjoy arts and culture and have experienced innate benefits yourself or have seen the positive impact on others. So arts and health is not an innovative idea. Instead, we need to think of innovative methods to incorporate the arts back into our routine as a powerful tool to enhance our health and well-being. I would also like to acknowledge the advancements in medical technology and medicine that have greatly benefited humanity, and invite reflection on how we can create a more balanced integration between these innovations and holistic practices, such as the arts. So before we move on, we'd love to see who's in this virtual space based on your line of work or interests. So I'm going to launch a poll right now. And this one is going to be, let me launch this.
Jenny, are you launching the first poll or the second? It looks like many people answered the first poll.
Oh, hold on. Oh, I think it was already on. Sorry about that. Let me see if I can get that back. Oh, perfect. So let's go ahead and see. So the question was, what fields do you work or are interested in? All of you here, let's see, we have between artist, culture bearer, and creative worker, an admin and nonprofit or arts org, health-related government funder or other, and you dropped it in the chat if you did. So it looks like a lot of you all are identifying as an artist and work in a nonprofit or art sector. But quite a few of you also in the health-related field, either as a clinician, working in public health or allied health, and also as creative worker and culture bearer. So thank you for that. I'm going to share the results for you all real quick so you can see that. Awesome. Thank you for sharing. And we'll have a lot more of these polls throughout the webinar today for your engagement so that we can also learn a little bit more about you all. All right, we'll close that. Okay, so imagine how we can empower people to take better care of their health and well-being by engaging in arts and culture activities that can prevent them from getting sick or developing chronic conditions. This will allow healthcare professionals to focus on treating patients and perhaps even alleviate healthcare worker burnout and reduce medical costs all around. Additionally, the arts can also help patients as part of their treatment plans and recovery process. So just like how we are told that physical activity and nutrition is good for our health, so is regular participation in the arts. These can be experiences by receptive engagement or active participation, such as watching a performance, listening to music and dancing, going to museums, attending drum circles, and painting classes. And you can read more about the health benefits of the arts on page 11 in the guide. So research is essential in the field of arts and health to provide evidence of its effectiveness, demonstrate measurable outcomes, and build credibility within the broader healthcare and public health systems. And so in the guide on page 39, you can click on these logos to learn how these groups are examining the ways the arts can influence health and well-being with evidence-based research, which includes stats and narratives. And on page 30 in the guide, you can check out some initiatives that involve cross-sector collaborations in community and clinical settings. And perhaps some of you already work for a program that use arts to improve health and well-being for your participants. And so I really invite you to think about ways that you can either create or build upon your program evaluation so that it can actually further support the research that we're all doing. And of course, gain more funding, which we all know plays a big factor. So most recently, a little under 2 weeks ago, CBS Sunday Morning featured a big piece on social prescribing with a particular focus on the arts and how it can help create healthier communities. It features Leia de Bessonet, founder and co-artistic director of Arts for Everybody, along with fellow co-artistic director Nataki Garrett, who was a keynote speaker at last year's CA Arts and Culture Summit. The CBS segment also features and interviews Dr. Jill Sankey, the founding director of the Center for Arts and Medicine at the University of Florida. Dr. Jill Sankey was also a speaker on our last year's webinar series. And you can watch Nataki and Dr. Sankey's talks on our YouTube channel, and we'll also share that in the chat as well. So we're going to watch this segment together and then hopefully serve as a grounding point moving forward for the rest of this webinar. So Natasha, if you can message if everything's working well in the chat for me once I start playing, then we're good to go. That way we don't have to rewind back.
Yes, no problem.
Thank you. All right, here we go.
If you're a loyal viewer of Sunday Morning, you know we spend a considerable amount of time covering the arts, which it turns out may be good for your health, as Dr. John LaPook explains.
Excellent. Could I just look at one other really quick moment?
Lear de Bessonet is not a doctor, but these days she thinks a lot about public health.
There was a time that we in America didn't realize how important a seatbelt was in a car, or we didn't realize how dangerous cigarettes were. But I don't think it's well known that the arts actually impact your physical health.
We have an opening for the princess.
De Bessonet is one of Broadway's most sought-after directors, and now the incoming artistic director for Lincoln Center Theater. Her reimagining of the 1959 musical Once Upon a Mattress, she's here with actor Michael Urie, struck an emotional chord.
Good.
So why, when watching a comedy, when everybody started singing, did I well up with tears today?
I know, I have that effect too. You know, I think there is something so deeply human about gathering, about telling a story, about laughing. And then let's see if we can just organically make that happen.
After years of directing, de Bessonet began to notice that some of the actors who worked with her saw mental and physical health benefits.
I would see a person who got a diagnosis from their doctor that they had just had a stroke and would not be able to return in time for our production 6 months later. And you know what? In 6 months, they were on that stage.
We have people in all 18 places that are there.
De Bessonet turned her passion for well-being into a national event. Last summer, thousands of people at 18 sites across the country took part in Arts for Everybody.
Art for everybody.
For everybody.
A celebration with the message, the arts can help create healthier communities, especially important at a time when loneliness is so rampant. Here she is leading a parade in the Bronx, New York, followed by a street fair.
Some people who we've told about the story have said to us, is this real?
I get that question a lot, and that's why I think it's important to point to things like the World Health Organization having 3,000 studies of the connection between arts and health.
Research suggests the arts can promote healing from illness as well as protect against a myriad of problems, including cognitive decline, heart disease, anxiety, and depression. Scientists are exploring the cellular mechanisms and brain wiring that might be involved.
Our life is grand.
But some things don't need to be understood to be appreciated.
Gray skies are gonna clear up. What would you say?
Put on a happy face.
There you go.
Like the ability of music to connect us and make us smile.
And why does that emotional connection improve our health?
And we know that we're more than flesh and bones. We're more than our bodies, right? And our soul needs food too.
I can prescribe penicillin. I can prescribe the arts, culture. How do I actually do that?
In the same way that it's very natural for doctors to recommend exercise to a patient. Exercise isn't medicine, it's lifestyle, but it has real health impacts.
It's called social prescribing, the idea that arts, culture, and community can be medicine.
I think that participating in the arts does so much for us physiologically, cognitively, socially, spiritually, and uniquely. It does all those things all at the same time.
Jill Sankey is the founding director of the Center for Arts and Medicine at the University of Florida.
We know now that there are arts programs in about half of hospitals in the United States. Mostly we hear that patients discover unexpected joy in a very difficult moment of their lives, and that can be really transformational.
Is it being introduced to medical students, first year?
It is. Studies have shown that 75% or more of medical schools around the country are engaging the arts in medical education.
The idea of prescribing the arts to improve health is gaining momentum. For example, In Massachusetts, a new statewide initiative is connecting more than 300 cultural organizations with healthcare providers. Also spreading the word, a national group called Social Prescribing USA. And earlier this month, the Federal Reserve Bank of New York held an event exploring the potential economic benefits.
I think that what we have been doing in the past hasn't gotten us very far. Our health outcomes are not great. Our health care costs are immense. And so we have to be open to innovative new things.
Paloma Izquierdo Hernandez runs Urban Health Plan, which serves 90,000 people at 26 Bronx community health centers.
Our community is one that has been underserved in many, many ways over many, many years. So bringing innovative programs to them, you're giving them the opportunity to make real impactful changes in their lives. And some would never get that opportunity.
I really can't explain it, but there's always a different way of connecting with stuff.
Therapists at Urban Health Plan recommend a number of classes to help Rosie.
We're either cooking class, the writing class, the reading class. There's always something special about it.
Do you have any thoughts about whether it's more beneficial to your health to just sit there and observe art or culture, or to actually participate in it?
You should do all the things you can do, to engage.
Nataki Garrett is Arts for Everybody's co-artistic director.
Anything that makes you stop, slows you down. Write your stories, go see a play about somebody else's story, sit in the park, listen to free music, come home and sing songs to your own children. It's all about having that connection.
Don't feel like you have to be good at something in order to get physical benefits from it. Sing badly, dance badly.
I can do that. I can do both of those.
Yes, but sing and dance freely.
Yeah.
Yeah, just do it. It's a just do it kind of thing.
For Lear de Bessonet and her Arts for Everybody team, the healing power of just doing it is no leap of faith.
I've seen it, I've lived it, and that's why I believe in it.
Okay, so feel free to share in the chat what you think about that video, and you're able to rewatch this in the PDF with the link in there too. All right, so in the video, they mentioned the approach of social prescribing, and in particular, arts on prescription, which you can read more about on pages 19 and 21 in the guide. And in addition to prescribing medicine or therapy sessions, what if doctors can also prescribe these activities, such as the arts, physical activity, being in nature, and volunteerism? You may already do these things on your own as part of your daily or weekly routine. However, some people may need that extra push to feel that they have permission to do these things with the power of a prescription. Some people may not know where to start or have the resources, such as extra money to pay for class fees or transportation. And some people, I'm sure you know them, will take their doctor's words more seriously and ignore their family and friends when they suggest these things. So therefore, social prescriptions are an additional method of trying to achieve positive health outcomes. So now, Nafesha, can you please launch poll number 2? Awesome, thank you. And the question is, what type of social prescriptions do you wish your doctor's type of your doctor would give you? It can be the arts, physical activity, nature, service, all of them, or maybe something else. You can click on other and share in the chat. We'll give it a few moments for you all to vote on that. Oh, and Nafesha, I think we have to relaunch the poll. Here, I'll see it real quick and we'll relaunch it. All right, here we go.
I think, okay, is it relaunched now?
Yes, yeah.
Okay.
Yeah,
Thank
we'll
you.
give it a few moments. So again, the question is, what type of social prescriptions do you wish your doctor would give you? So right now, okay, we won't reveal the results yet, but it's definitely ticking up. All of them are ticking up. Give it a few more moments. Okay, and I'm gonna stop the poll in 3, 2, 1. All right, I'm going to share the results. So you should all see the results. It looks like all of them, not surprised, Awesome. Thank you all for sharing. Okay, so let's walk through a scenario focusing on the arts as the prescription to better explain this approach. All right, so imagine you're going to get your annual physical exam or seeing a new doctor as a new patient. And as you know, there are lots of paperwork and forms involved, asking about your medical history, questionnaires about your lifestyle, like your diet, exercise habits, alcohol consumption, etc. And a patient-held questionnaire known as a PHQ-9 or something similar that assesses the degree of depression severity. And with the high volume of appointments and the busy schedules of doctors, you're lucky if you get a whole 10 to 15 minutes to speak with them. And when you see your doctor in the exam room, they may ask you if you're feeling any pain or discomfort anywhere in your body. And notice how the doctor's questions are aiming to find out what's the matter with you versus what matters to you. And after sharing any complaints or ailments you may have or experience, the doctor may then proceed to prescribe you medication and suggest making changes to your diet and tell you that you need to exercise more. So depending on what you indicated on your PHQ-9 questionnaire, they may or may not ask you more about your mental health. Then they may hand you some pharmaceutical prescriptions and brochures of physical activity or nutrition guidelines to read on your own, and then say, hey, see you in 6 months or next year. I gotta go, before rushing off to see the next patient. And we're all aware that healthcare workers are doing the best they can, and they may be dealing with burnout, limited resources, and staff turnover. So now let's say in the second scenario, it's similar to the first one. The only difference is that you also fill out a questionnaire about what matters to you, maybe sharing about your hobbies and interests. And as you chat with your doctor, they may ask you to elaborate more about this. And if they feel that you may be struggling with a mental health condition, which diagnosis and treatment may be required, they may refer you to a clinical therapist for conventional talk therapy, or perhaps a creative arts therapist, which you can read more about on page 17 in the guide. Or if your doctor thinks that you may be just feeling a bit down due to a breakup or job loss or loneliness, and perhaps you need to find some ways to cope to prevent your mental health from becoming worse, your doctor may give you a social or arts prescription. Maybe your doctor recommends that you need to be at a healthier weight and learns that you like to dance. So next, your doctor will connect you to a connector as a referral. And the connector, what they do is that they will find a community-based org or arts and culture center in or near your neighborhood that offers dance classes that fit your schedule. And not only will they arrange transportation for you if you need it, the classes may be at no cost to you, ideally covered by insurance. And all you have to do is make the effort to attend the classes for however long they are, maybe a month, maybe 6 to 8 weeks. So the connector will be accessible if you have any questions throughout the process, and they will update your progress to your doctor, such as you don't feel as lonely because you've made connections with others in class. Your mood has improved, you lost some weight, and you have more energy. So this process is basically the idea of arts on prescription as a referral-based system in which healthcare and communities work hand in hand. And you can read more about the program pathway on page 24 in the guide. Since many of you on this webinar are members of CA for the Arts or identify as working in the arts, I want to speak a little more about the service provider's role. They can be an organization or agency that provides programs or services with trained staff specializing in various art forms, and they have resources in-house already, such as their own facility, materials, equipment, and existing program curriculum. And what is really important is that they are familiar with the community, which means they understand the populations they serve and identify key issue areas around the neighborhood that they can address and bring up. So some benefits of arts on prescription programs for service providers include stronger collaborations with healthcare facilities for participants and which means just more consistent program enrollment. They can gain stable and diversified funding, which leads to more secure jobs for artists, facilitators, and staff, and along with more professional development opportunities. And all of this enables service providers to be a key partner in public health and wellness initiatives. So even with all the momentum that's been growing, it may feel like we have a lot more questions right now than answers, and that's okay. It's important to compile questions on various topics, such as these, to be able to address them and figure out solutions. And one of the most complex and common questions is the how. How do we start? How do we get funding? How do we implement? How do we measure? So if there are any other how questions I forgot, please drop them in the chat too as well. And again, speaking of questions, as a reminder, Nafesha mentioned in the beginning, if you have any questions for me or Nafesha, please click on the Q&A button at the bottom of your Zoom window. That way you can type in your questions in the pop-up window and they don't get lost in the chat box. And I can write them responses in the window or respond to them verbally at the end. Again, due to the time limit of our time together today in this webinar, not all questions may be answered, or I may not have an answer. So we definitely still encourage you to drop your questions in that Q&A box because they will definitely inform us of what we should be addressing in the future. Okay, so what other things to keep in mind is the what. What art forms to use? What issue areas can programs address? So let's take some polls to learn more about you and what you're all interested in. I'm going to invite Nafesha back on screen. There we go, to help read some of the results. So, and just please note that the Zoom requirement is that it only allows up to 10 choices per poll. So we're aware that there are more choices beyond the ones listed here that exist. Okay, so our next poll number 3, go ahead and launch that, please, Nafesha, is which art forms are you interested in? And you could select more than one choice. Here we go. So it may be music, visual arts, dance movement, theater drama, writing poetry. And if it's something else, please click on other and then share in the chat. And then we'll give it a few moments before we share the results with you all. And Nafesha, go ahead, feel free to monitor that and see.
Yeah, for sure.
Yeah.
I'm seeing results come in right now. 80%, somewhere around 80% is kind of fluctuating. Visual arts is definitely at the top, and then we have music coming in second. Dance and movement looks like it's third, and writing and poetry is right there with dance and movement. And in theater and drama also is, and then we have a like 6% with other. So it's a pretty good spread.
Awesome. Let's go ahead. We're going to end the poll and share the results for you all so you can all see what we are seeing. There we go. And we have some additional other art forms being placed in the chat. So thank you all for doing that. Okay, we'll go ahead and stop sharing that poll. And then our next poll are the topics. Poll number 4. Which topics are you interested in? And you can select more than one. Mental health, loneliness, trauma, chronic conditions, or medical conditions, disaster response, grief and loss, stress management, academic performance and success, or maybe it's technical performance, meaning that you actually teach the technical skills of maybe dance, ceramics, performance factor of being in a orchestra, etc. And maybe something else you can share in the chat.
Yeah, Jen, the results are coming in right now. It looks like mental health is at the top, which is not surprising, right? And then stress management, also not surprising when we're talking about professionals. And loneliness, which I think social prescribing talks a lot about. Grief and loss is up there with about 60%. So it's pretty solid with those. And then some of the ones that are about trauma is at about 57%. And I'll share these results. Whoops, I ended the poll. Sorry.
Go ahead and click share results so they can see it too.
There you go.
Mental health and loneliness. Awesome. Thank you. We'll move on to the next slide for a couple more polls here. All right, so other considerations include different populations, location, and setting. So poll number 5 is, what locations are you interested in? You can select more than one. And I also invite you to share in the chat box what city and state you are in. I believe we also may have some international folks here. So the choices for location are rural, urban, or maybe something else.
Yeah, I see in the chat somebody were suburban or even virtual, which is an interesting thought to think about, especially the amount of work that we do virtually. Tribal, another one that was mentioned. But right now, not surprisingly, urban is at about 88%, just probably because the demographic populations are higher in urban populations. And then we do have an interest in rural, which is at 35%. But these in the chat are very helpful also.
Yes, thank you. Go ahead and end the poll and share that for them to take a quick peek at the results. Awesome. Thank you. And then our next poll is about settings. So we'll go ahead and launch number 6. And the question is, what settings are you interested in? It might be clinical settings in a hospital or a community clinic, or maybe it's a community setting which falls under, nonprofit, schools, elementary schools, higher ed, churches, maybe something else. So feel free to take a moment to select that and drop some suggestions, other ideas. And yep, the workplace. Yep, it's another one. Yes.
Really,
knowing there's, I'll go ahead.
Oh no, I was just gonna say the chat is really great to see
Yes.
the settings, even youth detention centers, like you mentioned, museums, gardens, outdoor green spaces, all really good. And in the poll, I'm seeing community settings are at 94%. I'm going to go ahead and share those results. Clinical settings at 40%, and then other, which is probably the people in the chat and sharing out, 21%.
Awesome. All right, and we'll take our last poll. Thank you all for sharing, super helpful. Our final poll, number 7, is populations. What populations are you interested in? And again, this is not an exhaustive list, just some examples. You might be working with youth, older adults, veterans in the military population, people with disabilities, the incarcerated or reentry programs, employees in the workplace, or maybe you work with students of all ages, caregivers, healthcare workers, and maybe something else.
Sweet. And these results are coming in. It's very interesting to see. Youth are at the top right now at 72%. Older adults is also at the top. Seeing students being recognized as 65%. So, and the other ones are very competitive with like employees, caregivers, healthcare workers, all between like 40 and 50%. Veterans at 30%, and incarcerated or reentry at 30% also. There you go. And I'm going to go ahead and share that.
Awesome, thank you. And all of these different considerations, we know there's many different populations, locations, topics, and they're all important. So thank you all for sharing and doing the work that you all are doing and or are interested in doing in the future. So thank you, Nafesha. We'll go ahead and stop sharing the poll. Okay, let me go ahead and click on that. All right, let me go back to our slide. Okay, so we've all seen ads on TV selling pharmaceutical products. And Ozempic is a current one that has been trending a lot. I'm sure you have all seen. And the controversy revolves around the drug's increasing use for weight loss, despite its initial approval for diabetes. So sparking concerns about potential shortages for those who need it and the side effects. So we're going to watch this commercial together, and I invite you to notice what activities the people are engaged in. So here we go.
Type 2 diabetes? Discover the Ozempic Trizone. Ozempic! I got the power of 3. I lowered my A1C, CV risk, and lost some weight.
In studies, the majority of people reached an A1C under 7 and maintained it.
I'm under 7.
Ozempic lowers the risk of major cardiovascular events such as stroke, heart attack, or death in adults also with known heart disease.
I'm lowering my risk.
Adults lost up to 14 pounds.
I lost some weight.
Ozempic isn't for people with type 1 diabetes. Don't share needles or pens or reuse needles. Don't take Ozempic if you or your family ever had medullary thyroid cancer or have multiple endocrine neoplasia syndrome type 2 or if allergic to it. Stop Ozempic and get medical help right away if you get a lump or swelling in your neck, severe stomach pain, or an allergic reaction. Serious side effects may include pancreatitis. Gallbladder problems may occur. Tell your provider about vision problems or changes. Taking Ozempic with a sulfonylurea or insulin may increase low blood sugar risk. Side effects like nausea, vomiting, and diarrhea may lead to dehydration, which may worsen kidney problems. Living with type 2 diabetes?
That's about the power of 3 with Ozempic.
Okay. So we know that these ads have to disclose side effects, and they often have to have them written in small letters at the very bottom, or someone reading it off, all the warnings at the very end, very quickly at the end of the commercial. But notice the people in this commercial were dancing and taking a boxing class, and they seem and appear to be having fun. So maybe instead of an ad for medication, this commercial could easily be about prescriptions for dance and fitness classes to help improve your health. So here's another example of a commercial that we will watch now.
Look out, 'cause here I come.
Have you always had trouble with your weight? Same.
Discover the power of Wegovy.
With Wegovy, I lost 35 pounds. And some lost over 46 pounds.
And I'm keeping the weight off.
I'm reducing my risk. Wegovy is the only weight management medicine proven to reduce risk of major cardiovascular events such as death, heart attack, or stroke in adults with known heart disease and obesity.
Don't use Wegovy with semaglutide or GLP-1 medicines or in children under 12. Don't take if you or your family had MTC, MEN2, or if allergic to it. Tell your prescriber if you are breastfeeding, pregnant, or plan to be. Stop taking and get medical help right away if you get a lump or swelling in your neck, severe stomach pain, or any of these allergic reactions. Serious side effects may include pancreas inflammation and gallbladder problems. Call your prescriber if you have any of these symptoms. Wegovy may cause low blood sugar in people with diabetes, especially if you take medicines to treat diabetes. Call your prescriber about vision changes, if you feel your heart racing while at rest, or if you have mental changes. Depression or thoughts of suicide may occur. Common side effects include nausea, vomiting, diarrhea, constipation, stomach pain, flu or upset, headache, feeling tired, dizzy or bloated, gas, and heartburn. Some side effects lead to dehydration, which may cause kidney problems.
With Wegovy,
I'm losing weight.
I'm keeping it off.
And I'm lowering my CV risk. Check your coverage before talking to your prescriber about Wegovy.
All right, so in this commercial, notice that people are making social connections, and this person is making art in nature. And the ad says that this medication can help people lose weight and keep it off in big, bright letters. But look at the bottom. It says people who stop taking Wegovy generally regain weight, which means they will have to depend on this medication for a very long time. So maybe before considering medication, perhaps it's better to try other activities that you enjoy doing for health benefits. So I invite you next time you see these ads, pay attention to what the actors are actually doing in these commercials. So some of the key points today that we shared is engaging in the arts has health benefits for personal well-being while increasing social cohesion. Unnecessary medical procedures can be avoided and less dependency on medication is favorable. Hopefully a big takeaway is that artwork is real work and artwork is health work. Strategic partnerships and encouraging knowledge sharing are key elements of success. And in summary, in times of crisis, while first responders focus on immediate rescue and saving lives, the arts offer powerful ways to heal, cope, and support long-term recovery, making artists essential second responders. In recent years, from global pandemics, nationwide social injustices, and environmental disasters, we have witnessed the important role of the creative workforce to help communities rebuild. And building on this introduction guide, stay tuned for additional resources designed to provide further educational insights and support your efforts, which includes a policy brief and advocacy toolkit. There is great need for this work on so many levels, and I believe that there's enough space for everyone to learn and contribute to this field. So thank you so much for listening today. You can follow up on all the projects I'm working on at this link. And now we're going to take a look at the Q&A question, and I'll invite Nafisha back to our screen here.
Hi, excellent job, Jen. We have a few questions in the Q&A, and I think starting with one that I had said we would make sure we would answer live, and not necessarily answer because I don't know that we all have the answers to this question. It's a very heavy one, or a larger one, not heavy necessarily, but how do we think the current changes at the federal level for public health and other healthcare will affect social prescribing moving forward?
I knew this question was going to come up. And again, I think it's a big question. I think, some folks are thinking that the arts is that because of everything going on, it's going to not get its limelight and spotlight, and it will get deprioritized. And so I think the key aspect is how do we message that the arts is integrated? It's not, a byproduct of something. And with everything going on, I think, with a lot of the colleagues that I work with, people at different orgs, individuals from all different roles, many hats, is that we're just going to keep doing the work that we're doing the good work that we're doing, and hopefully really making that case of how the arts and culture can really help with community well-being. It can help better stimulate the economy. So there's a lot of different factors. And again, there's no direct answer to this question, but I think it's just about doing the work, keeping our goal in mind, staying dedicated, connected with each other, support each other, lean on each other, so that we can perhaps move this forward, regardless of the barriers we're facing now.
Right. That's a great answer, Jen. And I think that when we think about the even like economic efficiency, Angie in the chat or in the Q&A asked a question about the economic benefits and how of when it comes to like any correlations. I'm trying to like condense her question, but I'll read the whole thing. Is there any national database on studies related to health and the arts benefits after experiencing art, like theater, singing, earthing, crafts, etc., that tracks the past 50 years or comparisons with Europe that has been more progressive arts, had more progressive arts programming? Do we see any correlations related to the cost of healthcare and the decrease in public arts funding in the US?
Yes, thank you so much, Angie, for your question. From my research and what I've learned the past few years is that for the US, we haven't had a very specific study on the economic factors. There's been smaller studies. We really do look at our friends over in Europe and Canada who's done more extensive research on that. So I know Canada just released a report called A Healthier Canada a few months ago, talking about how it impacts their economy with medical costs to individuals, and then at the federal level too. So take a look at that. And I think that's what we need. We definitely need to be able to do more cost analysis on that. And in the guide, it does go through the funding sources of the 3 typical ways that these programs have given provided funding. So take a look at that section in the guide, and hopefully it'll give you some leeway. And again, we invite all of you to do, research on your own and share with us anything you also find. But there's definitely a big need for the US to conduct this type of study and research.
Absolutely. And I think we have enough time for Stephanie's question in the chat or in the Q&A also. The arts have become more and more exclusive and inaccessible. The arts are no longer for and by the public due to social and structural barriers. How do you and how do we address these systemic barriers that create disparities and inequalities in both the arts and health?
Great question, Stephanie. Even just from the way you structure the question, it speaks to me how we really have to look at this from the public health lens. With the equity, accessibility, all those different topics, my vision has kind of been more clear in the last year is, besides just, more access or more funding, it has to be about how do we change people's behavior, how we think about arts participation. So later on tonight, I am doing another webinar called Social Prescribing and Public Health. I'm also presenting next week at the Public Health Education Conference in Long Beach, California. And it's going to kind of showcase about, you may all have seen the graph about how, 80% of our health is determined based on our zip code, right? Where we live, our surroundings, do we have enough green spaces, job factor, all those different things. And then only 20% is determined by our access to quality healthcare. So, and a big chunk of it also is our lifestyle. We choose, to eat healthier or not, we choose to exercise or not, alcohol consumption, smoking, all those different things are lifestyle health behavior choices. So how can we add in arts participation and arts engagement as another factor of social economic status, right? To be able to not only have access to these things, but also make it as part of a health behavior. And hopefully that will kind of break the stigma and bring it back to what it once was, where it was part of our human basic need.
And I'm sorry if anybody can hear my dog in the background. He's being loud right now. Okay, good.
He agrees, your dog agrees.
Like, yes. No, I think so much of this, and I've learned so much from you as coming on to our team. And in the guide, you go through like the things that are happening in Europe, things that are happening in Canada. You can access all of that in our guide. And when you look at the one slide that you have about the scenario 2 and social prescribing, and I'm kind of just riffing on what Stephanie asked and thinking about from the service provider to that dance class or to that art class or whatever it might be. Where's that? I think when we think about equitable practices, think about who are the lists that the service provider has, right? Like in your community, and making sure that it's people connected to your community, maybe people you might know, like, so that you can go and have a art experience that is connected to who you are and your identity also, and where your geographic location. So I think there's a lot of pieces to it that we're constantly working through and thinking about.
Yes, thank you, Nafesha. And Jane, to answer your question about if the guide has like the nuts and bolts of how to set something up, it does not. It's more of a bird's eye view. However, it does have in the resources section, the field guide was created probably almost 2 years ago now, that will give you an idea of how to set this up in your own state too.
The anonymous question there, I don't know the answer to that one. And I think
the question is, how do you get an organization to be that a dog can prescribe to? I would say join Social Prescribing USA. We're a volunteer coalition group trying to gather a lot of folks at the healthcare level to be able to kind of determine how can this work in the healthcare setting. There's some places that are doing some sort of programming, but again, the big question is how do we get this streamlined throughout the whole entire system for the country?
Mm-hmm. Excellent.
All right, I think those are all the questions. Thank you so much. I'm going to go ahead and share this last slide. So thank you all again so much for your time. Looking forward to connecting with you all and virtually in person. I'll hand it back over to Nafesha.
Yeah, for sure. Thank you, Jen, for putting together the guide. I think it's going to go a long way. It's a foundational guide. There's so much more. There's a lot more questions. There's a lot more to learn. And we're continuing to work toward this. This is an initiative that CA for the Arts is committed to as we see social prescribing advance here in the state of California and throughout the US. These are ways that you can stay connected. We encourage you to sign up for a newsletter. Every week we have a new newsletter going out. So please sign up for the newsletter, and then also follow us on social media. If you go to CA for the Arts on all of our social media, you'll find us. And if you have the ability to be in Sacramento for the summit or Arts Advocacy Day, we welcome you to join us. And even if you can't, we encourage you to celebrate Arts, Culture, and Creativity Month within your community. There is still time to throw events and maybe tag it onto an event that you're already doing. Take our logo and run with it, and share with us some of the results of you bringing your community together for Arts, Culture, and Creativity Month. And we continue to celebrate. So thank you, Jen, and the entire team. Again, we shouted out our comms team, Jean, who will help work with the guide. And as always, I want to recognize Julie, our CEO, for the work that she has done to lay the foundation that we continue to build off of. I think that's everything that I got.
Yes, and again, this recording will be provided onto our YouTube channel. The deck will be sent out as well, along with all the links to everyone that's registered.
Great.
Right. I think that's it, Nafesha. Thank you, everybody. Stay healthy, stay well, and continue to create a better community for all of us in arts and culture.
Enjoy the day. Thank you.